Good morning. So I am just back from a night shift here in New York. It was day, 24 or something like that. I really wasn't planning on doing a video this morning, but hey, sometimes weird things happen, right? So I got onto the bus this morning, getting ready to come back, just kind of dead tired, and one of my friends, co-workers, is watching a video.
Go viral. I'm sure I'm going to get some hate messages after this. Frankly, I don't care because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend in New York City who's on the front lines.
She's not on the front lines. She has a friend.
For safety, she cannot come out and say these things. So I am her voice. I'm not going
She's
to
her
name
voice.
names of people or hospitals for the safety of those involved. But this is her account. Okay, I am her voice here. I'm going to tell you what she has told me. She wants this to get out. Now, I'm sure this is not the case everywhere. I'm confident. I have friends that are in other places. They're on the front lines. They're in ICU. And it's not like this everywhere. But in New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder.
Murder.
Coming from a nurse who went to New York City expecting to help.
So, insane murder going on in New York City hospitals. Wow. That's some shocking, salacious shit, isn't it? I pretty much got a severe case of Forrest Whitaker eye from watching this crap. I did not watch the full 10 minutes and 25 seconds of it because I was pretty much in full conniption pretty early on. Now, I will say, I share this person's ultimate goal, which is good quality care for people in need. I am an advocate for my patients. If I think somebody is doing my patients wrong, I will make a big stink. I will make a big fuss. The comments on my videos are always open, and I work with a lot of people who are watching these videos. I am quite sure if somebody thinks that I am selling you a line here, they will comment saying, "Oh no, Dan's a patsy for the administration of the hospital." You're not going to see that. You're not going to see that. So I got some thoughts. I made some notes on this. Because ultimately, I think this person is doing an incredible disservice, ultimately, not only to the people who are here working in New York City, because some of this is just absolute, outright Boulder Dash BS. She's not here. She doesn't know. She's qualifying all this, saying, well, I'm sure it doesn't happen everywhere, and I'm sure, maybe not all the time, but boy, she's really selling this really hard as if this is the preponderance of what's happening in New York City, and that is absolutely not the case. And I say that as a person who is on the front lines here. I've been on the front lines here for several weeks, and I have connections with other people who I've worked with for years who are in many other hospitals in this city right now. And the things that she is presenting as typical simply are not so. So here are some notes. So she says she's not here. Okay, she's talking about all the meds that are being used. Well, guess what? A lot of the meds that she's talking about, I have seen used. I have seen high-dose vitamins. I have seen high-dose vitamin C. I have seen Plaquenil used. I have seen varying dosages of that used. And while I have not seen any anecdotal evidence that would make me in any way, shape, or form think that this has been positive for the patients, not only were these multiple different doses and different dosage schedules used, I am not seeing it used any longer. So even though the hospital that I'm in pursued this pretty aggressively, it's not seeing use right now, and nobody was laughing about it. It seemed like the sort of thing that people were actually trying and hopefully investigating as a possible route to give hope to patients who didn't have a lot of hope otherwise. and it's not being used. So, surprise, that's one thing that she is saying is happening that just isn't. She's talking about people that were getting these medications. Other places were getting better. The statistics that have been published by other accounts, other places, don't bear out what she is saying. I have not seen any study that has equated that the medications that she's advocating as being something special and helpful have had any sort of positive outcome. As a matter of fact, we've seen multiple of these studies stopped mid-study because there was actually evidence of harm. So I'm not sure where she's pulling some of this from, but it doesn't seem to be any place that's fact-based. What else? She's talking about treatment and treatment modalities for these people. And that it's basically trach. She's talking about traching these people, but no vents. That we're running out of vents, but people are getting trached, and nobody's getting BiPAP, nobody is getting CPAP, no high flow O2. Once again, this is absolutely not the case. I and other people have tried to lay hands on special extra protective personal protective equipment so we can go in there and use BiPAP on these people, because we are actually finding that BiPAP and other less invasive airway management techniques are showing to be superior to venting. And we're trying it. We're doing everything we can. This is why we're proning people. This is why we're turning people aggressively. This is why we are doing this stuff. And yes, it is a little bit more risky. These are methods of treatment of patients that do aerosolize the virus, and they put it into circulation in the air. And that's something that we have to be accountable for. And so I have told other people who don't have the same kind of full face, full respirators that I and some other people do. I'm like, hey, I'm going to take that patient. I'm going to put myself there because I have gear that's going to help protect me. If you don't have that same level of PPE, why don't you hang out here? I'm going to go in there. So we're doing it. It's happening. It's happening here in New York City, and it is saving lives. It is happening. There are physicians who are advocating for it. There are respiratory therapists who are pushing for it. And this is not the sort of thing that is being downplayed or minimized by a system or physicians in the city. It's just simply not the case. And this person is presenting this as if people are making the willful choice to kill people. She's not here. You're not here. You don't know. Who are you talking to? You need to talk to the people who are actually here, because I'm not sure who you're talking to, but no, not the case. So you also talk about equivocally that these people are not being consented for this. This is, once again, this is not true. How do you know what people are being consented for and what they're being told? You're not here. You don't know. I am seeing folks have discussions with these people about what their options are and what we can do, what we think the best treatment for that individual is. Not blanket treatment for what the system wants to force on somebody, but we're having discussions with individuals about what is best for them and their health needs. So yeah, consent and treatment is something that's happening continually. I'm seeing it done regularly with patients, and I approve of how it's happening in general. So you're talking about your friend who has all these problems. Your friend needs to leave. Your friend needs to get the heck out of New York. If your friend is telling you this, that this is the problem that they're having, and that they just can't stand by and handle it any longer, they need to pack up their crap and they need to get out of New York City. Because if they're standing here and they are seeing these things that they say that they are seeing, and they don't have the guts to stand up to it, and they're not doing anything about it, they are in breach of their ethical duty to their patients. And by whining to you, they are actually making the whole situation worse. Because what you're doing, you're not doing anything positive for anybody in this city. You're sitting here saying, Oh, I want to save somebody and I want to. No, you're trashing the whole system, and you're doing a disservice to these patients. You're doing a disservice to the professionals in this city, and you're not helping anybody. You need to really get over that, and you need to hold your friend accountable, and you need to be accountable too. So, and then blood transfusions. You're saying none of these people are getting blood transfusions. I had the duty last night of roaming around in our facility talking to other traveling nurses who are in our facility, and multiple people were giving blood products last night to patients that we were caring for. I've seen multiple people getting transfusions who were COVID positive. There's basically everything that you're talking about is been pretty much blasted. So what about the ultimate goal of what you're saying? The ultimate goal is what you're saying is we want better quality care for these people. Are there some things that could be better in New York City healthcare system? Yeah, I'm sure there probably are. There are several things that I've seen that I don't necessarily understand. They're not things that are done in the health system where I'm from, but at the same time, systems are systems. There are things that I don't like in the system that I've come from. I've never seen a system where I like everything there. I will tell you that in the time that I've been here, I have been treated respectfully by the people who work in this health system. They have been gracious to me. They have been welcoming. And I will also tell you without any reservation at all, I have really liked the patients of New York City. They have overall been really wonderful, warm, kind people who deserve really good quality care. And I am proud to be here to help lend them a hand. And I want them to know that, we care about the quality of care that we're providing to these people. And are there things that we will advocate for, and the things that we will ask for, and things that we would like to see done in some ways differently? Sure. Yeah, we're going to try to do that professionally. We're going to try to do that appropriately. But we're not going to try to jump on here and make stuff up out of thin air. Boulder Dash about things that don't exist, saying that we've been told by some, a mythical Squatch Yeti, alien nurse who we know who happens to be on the front lines. They said such and such. No. If you see it, you better be able to report it. You better be able to talk about it, because if you can't, your story doesn't really mean jack crap. And if you can't do that, you need to get out of New York City, because you're not going to do anybody any good. So that's pretty much all I have to say about that. I guess that was a 10-minute video, and I've now sat here and bitched about it for 13 minutes. So, yeah, and it gave me Forrest Whitaker eye. It drives me crazy. That's it for today. I'm going to go ahead and get some sleep because I'm really tired. So, I've already showered, and my bed is calling me. It's right there, and it looks really comfortable. So, I'm going to be here in New York for a little bit longer. I'm going to continue to try to talk about the things that I see, things that I think are important to this pandemic, things that I think are important for people to hear. And I'll tell you exactly what I think, because and I'll try to give you the best information I can, because this is not all easy stuff. This is complex stuff, and it's not, and it doesn't all really readily make sense, because there's a lot of things about this virus that confound convention. There's things about it that just don't go along the normal methods and routes of healthcare that we would expect and anticipate to see. I'll continue to talk about some of that stuff. Hopefully before too long, I'm going to talk about why some of these pop-up hospitals, like things like the convention centers and the ships that come in, why they're not really being utilized in quite the way we might anticipate. I've got some things to talk about with that. I've got some things to talk about with some of the stress. We've just had a New York City physician who apparently passed away. They committed suicide recently, and some of the stress that we're facing. the stress that especially these people who have been here before we were able to get here to lend them a hand, and the terrible things that they've had to deal with. And some of the terrible things that they have to deal with because people like these folks, they see fit to drag them through the mud and talk crap about what they're trying to do when there's no real factual basis to some of these accusations. So we'll talk about some of that as well. But I'm going to call it a day for now. Take care. Please be good to each other. Love each other. Try to strive for truth and intellectual honesty about all this stuff, because that stuff is important. So take care, and I'll catch you guys later. Bye.